If you have ever experienced vaginal itching, burning sensation while urinating, pain during and after urination, or you've been treating a particular infection for a while now, it comes and it goes, then this video is for you. Hi guys, welcome back to my channel. My name is Imedion Francis. In today's video, we'll be talking about yeast infection because 3 out of 5 women will experience it or have experienced it in their lifetime. And because of how common this infection is, we now have an influx of TikTok doctors. I am constantly amazed by the number of feminine products that is recommended on a daily on TikTok. If you see the number of supplements young girls and women are taking, you would think they have a life-threatening disease. Now, some of these supplements are used to treat yeast infection. So let's talk about yeast infection. First of all, let's start with our reproductive system. Now, our private part, our reproductive system is divided into two. There is the external and the internal. The external is the parts that we can see, the parts that we can touch, the parts that we should clean. There's a general term used to describe it, and that is called the vulva. For the internal, it consists of different organs, but we're going to focus on only one, and that is the vagina. One thing that young girls and women are so obsessed about is with keeping their vagina clean and healthy. But the vagina is an internal organ, and just like other internal organs, it does not need to be clean. It should not be clean because it can clean itself. Now, let's not confuse vulva and vagina. Vulva is the part that you can shave, that you should clean. The vagina is internal, that you should not clean. You are so obsessed with not having any odor down there, and it's this obsession that is one of the reasons that you will have a yeast infection. How? Now, the vagina has a healthy balance of good bacteria and small yeast cells. When people say you should do this, you should insert that so that you can have a healthy vagina, it's literally tautology, because your vagina comes healthy. Anything that you're going to insert is the reason that it's going to be unhealthy. Back to what I was saying. The vagina has a healthy balance of good bacteria and small yeast cells. Now, these bacteria, they keep these yeast cells in check. That means the bacteria is more than the yeast cells. These bacteria too, they keep the vagina acidic, and that will prevent microorganisms or fungus from growing out of control. Yeast is a type of fungus. So yeast infection happens when the small yeast cells in the vagina outgrows or outnumbers the good bacteria. How can this happen? Thank you very much for asking. But before we get started, please kindly click on the subscribe button and also like this video. When you like this video, you tell YouTube that I'm saying something good and they will show it to other people. Thank you. Remember when I said you should not wash your vagina? When you go out of your way to keep your vagina clean with feminine wash or scented soaps, you kill those healthy bacteria. As you continue to do that, the fungus is going to outgrow or outnumber those good bacteria because they are dead. And of course, that's going to cause a yeast infection. Number 2, sex. And that's because semen is slightly alkaline and the vagina is acidic. Number 3, fluctuations in hormones like estrogen. And this can happen during menstruation, during pregnancy, during menopause, or if you are taking any kind of hormonal contraceptives. Now, I've seen this a lot online that once your period ends, you should use this to wash your vagina, or you should insert this so that you can restore its acidity. And I can promise you, you don't need to do that. Your vagina is Miss Independent. It has all the resources necessary to keep it alive, to keep it healthy, to keep it clean. Your vagina knows that at a certain time during the month, an alkaline blood is going to pass through it. So it prepares for it. Menstrual blood is alkaline here. But once your period ends, the bacteria that is responsible for keeping the vagina acidic comes to restore its acidity. So you don't need to wash it with anything. You don't need to insert anything. Next, antibiotics. Yes, antibiotics can actually cause a yeast infection because while antibiotics is supposed to kill the bacteria causing any kind of infection, it also clears out the good bacteria that is supposed to keep the yeast in check. Let me explain. When you have a sore throat or neck pain or ear pain or tummy issues, you take antibiotics. Those antibiotics, they don't go to your neck or your tummy or your throat to kill the bad bacteria. It clears out any kind of bacteria that it sees, and that includes the good bacteria. That is why you should not abuse antibiotics. Any small thing, flagyl, cipro, amoxicillin, penicillin, stop abusing antibiotics. Next, prolonged dampness in the genital area, like sitting in a wet bathing suit, not changing out of sweaty clothes, not cleaning the vulva after taking your bath, or keeping your tampons and pads in for so long. this can cause you to have a yeast infection. This also explains why you can have infection while you're in your period, because menstrual blood, like you know now, is acidic, and that means that environment is very open for any kind of bacteria. So if you leave your pads or your tampons in for so long, aside the fact that it's going to smell, it can cause you to have yeast infection. Next, weaken immune system. Like maybe HIV or diabetes or stress, it can cause you to have a yeast infection. Actually, weakened immune system can cause you to have any kind of infection, because now your body cannot fight the bacteria or the viruses. Now let's talk about the symptoms. Number 1, severe itchiness in the vulva or vaginal region. Number 2, burning sensation or pain, especially after urinating. Number 3, you're going to have this thick whitish discharge that looks like cheese. I'm going to insert the picture. Now, I just want to add that you might have itchiness and burning sensation without the discharge. It's not all the time that you're going to have a discharge. Next, there will be redness and swelling of the vulva. Next, you're going to have pain during sex, and that's because you've scratched your vagina for so long, or rather you've scratched your vulva for so long. There's going to be cuts, there's going to be cracks. Even in the opening of the vagina, there's going to be cracks, and during penetration, it's going to be very painful. If you have burning sensation while urinating, and then you also have tummy pain or pain around the pelvic area, but there's no itching vagina, there is no discharge, then you probably have a UTI, and that is always bacteria. My points: once you start having some kind of funny symptoms around your vagina, go to the doctor so that they will diagnose you properly, instead of you to follow TikTok doctors to take antifungal. Now let's talk about how you can prevent a yeast infection. Number 1, avoid scented soaps, feminine wash, scented wipes, scented pads, anything that is scented, avoid it. Your vagina is not supposed to smell like milk and honey. It has a natural odor. You have a very specific vaginal odor. Now, there's a difference between your vagina smelling bad, like foul smelling, and then it having its own natural odor. Don't confuse the two. Your vagina has a very specific odor, and that odor is not like caramel or chocolate. Number 2, don't doubt. What is doubting? You want to clean your vagina. Why? Did he tell you to help you to clean itself? No, don't doubt. Number 3, I've seen this a lot on TikTok. Boric acid, cranberry pills, you should insert it inside your vagina so that it will be clean and healthy, so that to prevent yeast infection. Sweethearts, if the doctor did not say you should insert anything inside your vagina, please don't insert anything. In place of boric acid, take Greek yogurt. That's a probiotic. It's better for you to take something from your mouth than for you to insert anything inside. You will not be able to explain it though, so don't insert anything inside your vagina. Next, wear cotton pants. This is a scripture that we've been preaching for so long. Wear cotton pants. Next, avoid tight fitting underwear, tight fitting pants, anything that is tight around your vagina, avoid it. When you go to work and then you wear the tight, all of that, when you come back, remove it so that your vagina can breathe. Your vagina does not like extra moisture, any additional, it does not like it. It's a queen, so allow your vagina to breathe. Next, hydration. Drink water and take fruit. Like, I think we really underestimate what water can do, especially if you have like burning sensation while you're urinating. Drink water first. Give yourself water therapy before you go and take antibiotics. And also with the fruits, watermelon, cucumber. See, God in his wisdom, infinite mercies and graciousness, decided to plant all this fruit around, but no, you want to insert boric acid so that it can cure your yeast infection. Drink water and buy fruits. If you can buy boric acid, you can buy watermelon and cucumber. It's not that expensive. Drink water, my sweetheart. Drink water. Next, limit sugar intake. This is another scripture that we have all been preaching. Oral hygiene, sugar, limit sugar. If you want to lose weight, limit sugar. Now your vagina, limit sugar. I also want to add that diabetes is no longer the disease of old people. It's a disease of everybody. Hypertension too. So from time to time, go to the hospital and check your sugar level. Go to the hospital. You don't even need to go to the hospital to check your blood pressure. You can even buy the apparatus and keep it in the house and be checking for yourself. In fact, let me just add, for this Christmas here, if you're looking for something to buy for your parents, buy them sphingomanometer. That's how it's pronounced. Yeah? Yes. Buy it for them so they will be checking their blood pressure. Buy the automatic one, so it can be easier for them, especially if you're not in the house. Next, don't abuse antibiotics. You might not be using feminine wash, you might not be wearing tight underwear, you might be even be taking fruit and all of that, but antibiotics, you take it morning, afternoon, and night, because why? You have malaria and typhoid. Don't abuse antibiotics. Anytime your tummy pains you, you should not take flagyl every time your tummy pains you. Don't abuse antibiotics. Next, while you are treating yeast infection, don't have sex. please don't have sex. Just allow the drugs to do this job. Before you go now and say that you bought these drugs, they gave you these drugs and it did not work, don't have sex. Now, how can you actually treat yeast infection? You can treat it with antifungals, and it comes in tablets, cream, or suppositories. I'm not going to tell you to take over-the-counter medication. I'm not going to advise, in fact, stop taking boric acid or cranberry pills because they told you on TikTok that this is the thing that helps with yeast infection. Don't do that to yourself. Go to the hospital. Like I said earlier, how are you so certain that it's a yeast infection that you have? What if it's a UTI? And most times UTI are just antibacterial. What are you going to do? Oh, okay. All the symptoms that I've mentioned, you have it. So that's the more reason you should even go to the hospital instead of following TikTok doctors. Those TikTok doctors, if something happens to you, they'll rush you to the hospital. You cannot say this is a person that says you should take it. Go to the hospital. Sweetheart, go to the hospital. Let me tell you a story. Yeah? Last year, I had nail infection. So yeah, I'm a doctor. So I went and bought antifungal. And I was prepared to take this antifungal for like 3 or 4 months, because if you have a nail infection, Jesus Christ, it takes forever for it to clear. I started taking it. I took it for like 2 weeks. Then one day I sat down to read the leaflet, and then I realized that if you are taking antifungal, you need to also be doing liver function tests, because while that antifungal is killing the fungus, it is destroying your liver. And you've been treating yeast infection for how long? Every time you buy drugs, every time you buy, the new one that I'm seeing online is Clonival, and I'm like, really, guys? People just recommend any drugs like that. They'll just say go to the pharmacy and just buy any over the counter, when it's not paracetamol. Even paracetamol safe, if you take paracetamol for so long, do you know it can damage your liver? Well, I had to sit down to read what's inside Clonival, metronidazole, clotrimazole, and you're just taking it like that because somebody came online to say you should take it. This whole issue of overconsumption is happening a lot with feminine hygiene products. You can do better. That's why I saw again that, you should be using apple cider vinegar to wash your vagina so that it will do this. You should soak your vagina in this. You should do... You guys should leave your vagina alone. Leave it alone. It is tired. Leave it alone. With that being said, my name is Emedion Francis, and please, if you have vaginal itching or burning sensation, go to the hospital. Don't take any drugs from TikTok. I'll see you in my next video. I even forgot to say that people should subscribe. Please subscribe. That's how passionate I am about this yeast infection. Subscribe.